This is Fatma Khan, BP 1650068. Today, my drug of interest is Bupivacaine. Introduction. Bupivacaine is a prescription medication used as a local anesthetic numbing medicine. Bupivacaine blocks the nerve impulses that send pain signals to our brain. Bupivacaine injection is used to numb an area of our body during or after surgery or other procedures like childbirth or dental work. Its medications are specifically given to decrease the feeling in an area, mostly the feeling of pain. It blocks the nerves. It is injected around a nerve that supplies the area or into the spinal canal's epidural space. Rational use. Bupivacaine is a potent local anesthetic drug with unique characteristics from the amide group of local anesthetic. They are used in regional, epidural, spinal, or local infiltration, mostly in during the childbirth, during dental treatment, during or after any surgery, during intense pain, or to suppress the pain. Dose. Adult dose for local anesthesia include local infiltration injection should be of 175 mg with the 0.25% concentration. During epidural block, injection would be of 75 to 150 mg, 10 to 20 ml, but not for obstetrical anesthesia, and the concentration should be 0.75%. During caudal block, injection should be of 75 to 150 mg, 15 to 30 ml with 0.5% concentration. During sympathetic block, injection should be of 50 to 125 milligrams, 20 to 50 ml, while the concentration should be 0.25%. The pediatric dose for local anesthesia, mostly the children of 12 years or under, would be local infiltration injection should be of 175 mg with 0.25 concentration. Retrobulbar block injection should be of 15 to 30 mg, 2 to 4 ml, while the concentration should be of 0.75%. Dose adjustment. Dose adjustment of bupivacaine in spinal anesthesia. Bupivacaine 0.75% in 8.25 dextrose. In the perineum, lower limb, it would be 4 to 10 mg. In lower limb, it would be 12 to 14 mg. In upper abdomen, it would be 12 to 18 mg, while the duration of action would be between 90 to 120 minutes. Irrational use. Treatment of chronic pain with bupivacaine epidural blocks. The effect of impregnated autogenous epidural adipose tissues with bupivacaine on post-operative radicular and low back pain in lumbar disc surgery under spinal anesthesia. The side effect of bupivacaine includes abnormal heart rhythms, anxiety, apprehension, back pain, blood vision, cardiac arrest, cardiovascular collapse, chest pain. Drug interaction of bupivacaine includes drug interaction between bupivacaine and bupivacaine liposomes is a specially formulated anesthetic that releases the medication into the surrounding tissues at a controlled rate. Side effects may be rapid heart rate, shortness of breath, fatigue, etc. Drug interaction between bupivacaine and prilocaine may increase the risk of methemoglobinemia, a condition that can lead to oxygen deprivation in tissues and vital organs that can be fatal in some cases. Alternative drugs, lidocaine, marcaine. Alternative brands, Toffel 5% ointment, the retail price is 15 rupees. Naropen injection 5 mg, retail price is 450 rupees. Mepicaine injection 3%, retail price is 600 rupees. The case study. A 26 years old patient, height 155 cm, weight 58 kg with chronic rheumatic heart disease, was scheduled for elective cesarean delivery at 36 weeks of gestation. She had a normal in-hospital vaginal delivery 2 years ago. In her second pregnancy, she experienced one episode of dysphonegia and palpitations at 26 weeks gestation, for which digoxin 0.25 mg and furosemide 2.0 mg daily and ziltiazem 30 mg 8 hours was recommended orally. At 36 weeks, she had no palpitation or chest pain. Her heart rate was 80 beats per minute and BP was 110 by 64 mmHg. After a while, the ECG showed sinus rhythms, 86 per minute, with a right axis deviation, premature atrial complexes, and left posterior fascicular block. There was severe pulmonary arterial systolic hypertension, 51 mmHg. Her hemoglobin was 12 gram percent, potassium 4.8, and renal function was normal. it was decided that she should undergo elective cesarean section at 36 weeks of gestation. Firstly, she received diazepam 5 mg orally and aspiration prophylaxis, which includes tablet ranitidine 150 mg and tablet metoclopramide 10 mg. An antibiotic prophylaxis was given 30 minutes prior to surgery. That includes injection ampicillin 2 g and injection gentamicin 80 mg. The patient received combined spinal epidural anesthesia at the 1.3 to 4 level. She received 5 mg of hyperbaric 0.5% bupivacaine and 25 mg fentanyl. This resulted in loss of sensation. A female infant of 2.5 kg was delivered with APGAR scores of 9 at 1 and 5 minutes. Blood loss during surgery was 300 ml. An infusion of bupivacaine 0.125% with fentanyl 2.0 mg per ml at 5.0 ml per hour via epidural catheter was started at the end of surgery for post-operative analgesic. All the hemoglobin levels and ECGs was normal at that time, and she was discharged on the 4th post-operative day. Subjective. Elective cesarean section to prevent hypotension and tachycardia. Objective. 36 weeks of gestation cesarean section was made. Hemodynamic stability, spinal epidural anesthesia in patient with severe mitral stenosis. Plans. To start the treatment with digoxin 0.25 mg and furosemide 2.0 mg, and then further increase the drug combination and then shift it to analgesic combination.